Hello everyone, my name is Edgar Betancourt and today I'll be discussing my Unit 7 assessment, my program plan presentation. A written community plan is a blueprint of the collection of assessment data and the recommendations and interventions put into place to address the problem or problems that affect the specified community. The interventions are carried out by collaboration of community members, including residents, business owners, community organizations, religious organizations, medical professionals, law enforcement, and political officials. The issues within any community are problems that need to be correctly identified and resolved with the effort and input of the community as a whole. Proper identification of issues that affect the population within the community is important in developing a plan to address the health concerns of the targeted group. Primary, secondary, and tertiary prevention is vital in promoting the overall health of the community. A community health assessment, sometimes called a CHA, also known as Community Health Needs Assessment, sometimes called a CHNA, refers to a state, tribal, local, or territorial health assessment that identifies key health needs and issues throughout systematic, comprehensive data collection and analysis. This written community plan focuses on the Clark Fulton neighborhood in Cleveland, Ohio. The author, which is myself, will identify and present information that brings awareness to the complications that hinder one of Cleveland's most diverse urban communities. What is a definition of community? One must ask, what is it about the community that makes it stand out? The boundaries of the Clark Fulton area are Clark Avenue on the north, Scranton Road on the east, Daisy Avenue and I-71 on the south, and West 48th and West 49th Street on the west. It lies generally south of Ohio City, north of Brooklyn Center, west of Tremont, and east of the Stockyards. The residents in the Clark Fulton neighborhood consist of a small percentage of middle-class families and a larger amount of families that would be considered near or at poverty level. The community has been under a restructuring phase and has drawn the attention of small businesses such as coffee shops, donut shops, Puerto Rican restaurants with very delicious food, hairstyling and barbershops, pharmacies, and retail stores. The residents in the Clark Fulton neighborhood have several options for accessing health care. Stanhope and Lancaster states that the ideal public health systems reflect and evolve from the economic conditions and social, cultural, and political characteristics of the country and its communities, and are based on the application of social, biomedical, and health services research and public health experience. The residents in the community have access to one of the best hospitals in the greater Cleveland area. The Metro Health Medical Center is a level 1 trauma hospital that offers a multitude of services and is an exceptional research facility that has been focused on the advancement of treatment for neuromusculoskeletal conditions, cardiovascular diseases, cancer, and women's and children's diseases. Surrounding cities utilize Metro Health Medical Center for trauma and burn care. Metro Health Medical Center is a life flight hospital having the ability to fly their helicopter to remote sites and transport patients back to their hospital and provide urgent life-saving care. I had a chance to drive around the neighborhood of the Clark Fulton neighborhood. I'm very familiar with it. I work in the neighborhood as a home health care nurse, so I'm very familiar with the neighborhood, the neighbors, the stores, the streets. I actually went to school at Lincoln West High School, which is located centrally in the Clark Fulton neighborhood. So it was very interesting to jump in my car and see it from a different perspective as a nurse, doing a community assessment. The windshield survey is an opportunity for healthcare professionals such as myself, a nurse, to drive around the community and assess various aspects of the community that can be viewed from inside a vehicle. The community has a variety of services that residents can access on a daily basis, such as restaurants, barbershops, grocery stores. They have a Save-A-Lot, and they have a couple other corner stores and shops where people can get food. Gas stations, daycare centers, cell phone shops, clothing stores, and an animal clinic that's being in the process of being built right now. A hospital, which is Metro Health Medical Center, and many other services that are within walking distance or a short drive away. One of the bright spots in the Clark Fulton neighborhood is the City Life Center, where children can come to play, sports, be involved in cooking class, art class, dance class, video games, participate in Christian faith ministries, and receive mentoring and tutoring services. The building you see on the right was actually a boys and girls club that I grew up attending when I was younger, living in that area. Now it was bought by the Youth for Christ organization and turned into the City Life Center, which has, revitalized that area of the neighborhood, which was very well needed for the at-risk youth in the Clark Fulton area. Community assessment data generation. In the ethnically diverse city of Cleveland, Ohio, the age of residents fluctuates with the median age at 36.3 according to Cleveland, Ohio. If you can see at the chart below, Ohio, ages 0 through 19 in the year 2000 had 3,215,955 people. And you also see 60 and up is 1,963,489. And as you get closer up into the years of 2017, you can see how the numbers greatly increases, but you see a correlation between the young ages and the older ages, where the older ages obviously increase from 2010, 60 and up, increase to in 2017 to 308,000. But you see that it decreases from 2010 to 2017 from 325 to 290, which means that a lot of people in the area, basically they stay in the area and they grow old in Cleveland. Cleveland, Ohio has over 383,000 residents, making it the 45th largest city in the United States and second most populated city in Ohio behind Columbus with an estimated 890,000 residents. The population of the Clark-Fulton neighborhood has an estimated 11,126 residents with a population density of 11,030 per square mile. The Clark-Fulton area is the most densely populated neighborhood in Cleveland, Ohio. It's a lot of people in this area. The number of people in such a small area is noticeable by the constant traffic of cars and pedestrians that is visible by anyone visiting the neighborhood. Dense population is the product of large families living together due to migration in an attempt to afford the increasing cost of housing. The community is increasing in number, and teen pregnancy can be a contributing factor. According to Ohio Department of Health Bureau of Vital Statistics, the number of teen pregnancies in Cuyahoga County has reported in 2016 per 1,000 females were the rate is 1.1 from ages 10 to 14. The number was 562 age 15 to 17, and as you can see, the number increases, but you see a larger amount in the ages of 10 to 19. So the age gap of 10 to 19 obviously is 1,839 with a 27.4 rate, but as the numbers break down, you see that you see a correlation rather, I should say, of teens getting pregnant at an early age, but more so when they're in their upper teens, really starting at the age of 15 and age of 18. Disease incidence and prevalence for leading causes of mortality and morbidity. In the state of Ohio, the leading cause of death is unintentional injuries at a rate of 18.81 per 1,000 population before the age of 75, according to the Ohio Department of Health's State Health Assessment in 2019. The leading cause of death caused by morbidity is cancer at a rate of 14.15 per 1,000 population. Heart disease is not too far behind with a rate of 11.01 per 1,000 population. These numbers are indicative of the health issues affecting Ohio residents as well as the targeted population of the Clark-Fulton neighborhood in Cleveland. I'm going to be discussing obesity. So obesity has a lot to do with heart disease. And as you can see, the chart on the left, cancer is really high up there in the numbers. Unintentional injuries obviously is the number one cause. But if you can see heart disease, 18.40 among African American, which the Clark-Fulton neighborhood has a good amount of African Americans, and also Hispanics 5.38. But as you go further down, you could also see assault and homicides 12.50 for African Americans, and then perinatal conditions 9.67. So basically, the leading causes of death, I mean, the higher numbers, heart disease, cancer, and these have a lot to do also with diet and health complications. Healthcare facilities and providers. There are various facilities that are accessible for healthcare in the Clark-Fulton neighborhood. The Metro Health Medical Center is the major hospital system in the community. Metro Health is a level 1 burn and trauma hospital and is in a transformation process with the expansion of its current facility. The expansion involves the addition of an 11-floor hospital with 270 single occupancy rooms integrated with the latest technology to offer the best health care to its patient population. Metro Health Medical Center also has life flight services that provides helicopter transport for life-threatening emergencies. They also have dental, optometry, and family practice offices, all located within the Clark Fulton neighborhood, giving community residents options for their healthcare needs. For patients that require dialysis, the Cleveland Dialysis Center is conveniently located right across from Metro Health Medical Center. Several community agencies in areas such as the Hispanic Alliance, located at the intersection of Clark Avenue and West 25th Street, provide services in support of social, educational, and developmental opportunities within the Hispanic community. As you can see on the left, this is just a scale. This is a scale drawing of what the hospital is going to look like right now. They have the structure up. They're starting to put the windows in right now as we speak, but that's what the new hospital looks like. If you look to the left, in the back is the old hospital. Behind that, there's two towers. The two towers will be demolished, but this building right here, this view of this sketch is what the hospital is going to look like in the upcoming future, very soon. The community partners and resources. Establishing effective community partners is essential in executing goals created for community development. Stanhope and Lancaster mentions that partnerships and coalitions can help achieve population-level policy changes by focusing on multiple strategies with sufficient scale and scope. One of the partners involved with this Clark Fulton Community Project on childhood obesity and diabetes is Johnny Finer, director of the City Life Center in the Clark Fulton neighborhood. Mr. Fine is responsible for overseeing all activities and events that occur in the City Life Center. He's also responsible for raising funds for the City Life Center. It's going to be a program where the kids can come and hang out and have some after-school mentoring and tutoring, and also have cooking classes and just basically just have an opportunity to stay out the streets. To develop community health diagnosis is risk of ineffective health maintenance among the youth of the Clark Fulton neighborhood ages 11 through 19 related to insufficient resources as evidenced by rate of obesity. The community project will involve health education focused on obesity and childhood diabetes. There will be discussion groups to have conversations about the causes of obesity and diabetes and the interventions that can reduce or eliminate the cause. The City Life Center also has a gym where the youth can participate in basketball and volleyball, promoting physical activity. The local food bank also makes donations of fresh fruits and vegetables that can be distributed among the youth to encourage healthy eating. The goal of the project is to encourage healthy living by teaching health-seeking behaviors that will reduce the chances of developing diabetes by preventing obesity. Unfortunately, the City Life Center is closed due to the stay-at-home order that is in place here in Ohio due to the increased number of COVID-19 cases. Therefore, the project has not been implemented thus far. The proposed evaluation and plan. The participants would have filled out a survey and with questions regarding eating habits at the end of the program. Also, participants will compare their weight from start to the end of the study, and then participants would demonstrate how to properly plan and prepare a nutritional meal schedule. And that's all with the food being provided by the City Life Center. And of course, the nurse, myself, providing some teaching, some healthy eating habits, and how to monitor their health. In conclusion, all of the facts presented, the community project that will be conducted at the City Life Center is a great opportunity for the youth of the Clark Fulton neighborhood to engage and participate in activities that will change their physical and emotional well-being. By providing guided instruction and resources from within the community nurse, myself, along with the collaboration of the City Life Center, City Council, local businesses, and the Cleveland Food Bank, will give the youth of the Clark Fulton neighborhood the tools to a healthier outlook on life. Health promotion needs to be carried out by people and with people rather than on people or to people. This requires us to engage with communities in ways that allow people to have ownership of and involvement in all stages of health promotion activities. That concludes my community assessment plan. I hope you enjoyed it. Thank you for listening.